Unfortunately, I don't think Vicky has got onto the Zoom call at present. So she was going to be beginning the presentation, but I will begin in her place. We're talking about PACT therapy in Southwark and Lambeth community SLT services. You can move the slide, thank you. So basically we did training in October 2018, and we trained 15 therapists, and 3 had a change of role or left the service. 11 achieved full certification, and 2 left the trust. We currently have 9 fully trained therapists, and we received data from 8 of the therapists. 7 of those therapists saw 2 practice families, and 2 have seen additional children. So 1 saw 2 families and another saw 1 family. So 31 families received PACT intervention, and 132 appointments were offered. And 20 of those families had more than 4 sessions. So that was the minimum dose that we hoped to achieve. 10 had 8 or more sessions. And out of all those families, there were 41 DNAs, and that's about 31%. And that possibly related to the length of the appointment, but within average range for many services, especially in London. So we surveyed the parents, we surveyed 31 families, and the feedback that the community trust received was, they said that parents said 100% had good knowledge of the programme, 100% could identify changes in their behaviour and interaction as a result of the therapy. For example, I'm now able to identify my child's needs and identify what the goals for his communication need to be. I know more about how to plan play activities and how to respond to his play and communication. 80% reported increased confidence and well-being in supporting their child's communication. For example, one parent said, I was at a 0 in my confidence before, but now I'm at a 10. Another parent said, I've really enjoyed the sessions, and spending time with my child has been so much more enjoyable. And as a result of the strategies I've learned. So another continuing in terms of parents' views, 80% felt the use of video feedback, which is a key point in PACT, made a significant difference to how useful it was and the amount of progress their child made. I was not expecting the video feedback to be so useful. It was so helpful. The videos have been really helpful and have helped me to understand him and be more sensitive to his demands and more responsive to his requests. One parent said, I found it quite frustrating being asked lots of questions that I already knew the answers to. I felt that the therapist didn't interact with my child, and I didn't understand why this was. Just going back to that point as well, I mean, it's difficult because a question that often happens to the parent, you first come in and a traditional therapist will play with the child. So it takes a while to sort of work with the parent to help them to understand why you're sort of taking an indirect approach. So in terms of the child's behaviour, 100% of parents could identify change in their child's behaviour and interaction. Increased intentional communication. The parent said she is now bringing us things to initiate communication. Increased interaction with others. I can tell he really wants to interact with me now. Changes in levels of attention. A big change in her level of attention. She will now engage for a long period with me. Increased non-verbal and verbal communication, for example, using more words and gestures. She is using more words, for example, juice, and she's trying to sing more. She requests with verbal and non-verbal means, for example, saying row and pulling my arms to request row, row the boat. Other comments, for example, one parent said, all but one would recommend the PACT approaches to others. So that's out of all those families, only one said they wouldn't, and one said they'd already recommended it to other parents. One parent commented, I think I sat back too much with my older child with ASD and feel that with my younger child, the PACT therapy has encouraged me to be more intentional in my engagement with her. This has made a huge difference. As a result, I'm now trying out some of the PACT strategies with my older daughter, and I'm starting to notice a change in her attention and engagement too. So we had, in terms of positive feedback from the therapists, they said the parents really enjoyed the sessions and the approach is great and they can see the progress with the families. The parents have an increased awareness of the small differences, and it could take weeks, but once they get it, they really got it. Parents help to see for themselves. Parent willingness to attend for a 90-minute session, indicative of commitment. So often it depends. The sessions can be anywhere between an hour and a half. So it is a real commitment. But the fact that parents are able to attend just shows how effective the therapy can be. Other parents, the therapist really felt that the child had gone from being non-verbal to using words. In terms of challenges for the service, obviously in the NHS, they have a very, very busy diary, and scheduling SLT diaries booked in advance makes it quite difficult to put families in soon after receiving the training. There's a risk of moving parents on too fast and moving through the levels. So you just need to be very careful when the therapist is doing the actual therapy, that they don't rush through the stages, and it's not necessary to reach the end. It's just important that the parents really achieve those different stages. In terms of using interpreters, results in a very long session, so it can be quite difficult. And especially in London, for example, we have a lot of parents whose English is their second language, so a lot of them did need interpreters. There's problems in terms of training interpreters and having a consistent interpreter for every session, because that doesn't always happen. The therapy relationship is possibly affected also by using interpreters. The approach may be child to parent, and it could be vice versa. So it could be it really works for the child, but the parent is just not their style. That could also hinder the therapy. The challenge of the time needed to talk to parents when only a short time spent videoing helps the second parent. A lot of parents whose English is. And in terms of attendance commitment, this varies for families. Some families have many, many appointments, especially when you've got a child with special needs, and this could impact on the consistency of the sessions. Again, a lot of the therapists felt that ongoing supervision would be really beneficial. In terms of future plans and lessons in this area of London, we will continue to offer it to families who would benefit from it, and we will explain clearly what PACT entails and our rationale for this approach, just to make sure that parents have a very clear understanding of what it's all about and the positive outcomes and experiences of other families when offering it to the families. And that's it really. So I'm sorry that Vicky couldn't get on. So I know that she really wanted to give this presentation, so I apologise for that. But maybe she'll be able to speak a bit later. Thank you.
Thank you, Jess. And that was a fantastic presentation.